MRSA is it's MRSA, and those are the initials for methicillin-resistant Staphylococcus aureus. Long word, long term for basically a bacterium, Staph aureus, which is on our skin. It's kind of everywhere in the environment as well. But this one is resistant to penicillins, which had been the mainstay for treating Staphylococcus aureus. Now, what is Staph aureus? It's a bacterium, like I said, that's common, but it sits on our skin, but when it causes infection, it can cause all types of infections, blood infections, some of the flesh-eating. It's one of the flesh-eating bacteria that you hear about when people get piercings and it gets infected. It can cause all types of infections throughout the body. The problem with MRSA is that it's resistant to a lot of antibiotics. Historically, MRSA was something that we saw only in the hospitals initially, and that was because the hospitals are where antibiotics are, or had been. And so if people were on a lot of antibiotics or on antibiotics for a long time, the bacteria would develop resistance. However, it has now been found in the community as well, initially with people who take drugs, who would use intravenous drugs, and people who were diabetic and who were basically what we call chronically ill, who may be in and out of the hospital. In addition, in the community, people take antibiotics, but they don't necessarily take them appropriately or for the right duration of time. So over time, this bacteria, which like I said, is kind of everywhere and it's on our skin and throughout, can develop resistance. One of the other problems is that because it's everywhere, you can get it if someone has it, someone that you live with, your husband, if your spouse has it on their skin and you're sleeping in the same bed with them or using the same towel or sharing clothes, then you can get it on your skin. That doesn't mean that you'll get an infection. However, you can get pimples that become infected with it, or you can get, if you get a cut, it can become infected, or I had mentioned before, piercings, those can also get infected with it. Some hospital workers have what we call nasal carriage. So when you swab their nose, they have Staph aureus that may have MRSA. Not just hospital workers, but people who come into the hospital. Now we actually test everyone when they get admitted to the hospital to see if they have it, because if that's the case, we can't put them in a room with someone who doesn't have it. It depends on what type of infection you have. As I mentioned, you can have it in your blood. How do you get it in your blood? Usually we see that in people who have, maybe they're dialysis patients, so their kidneys have failed, and so they have an intravenous line, and it can get into the line. People who are using intravenous drugs can get it. Sometimes people who, for whatever reason, there are a lot of people out in the community who have some kind of immunocompromise, not just HIV patients. There are a lot of people who have had transplants, people with arthritis and other autoimmune conditions, diabetic patients. All of them can be at risk for getting this infection. A lot of times people with diabetes have nerve problems and they get cuts on their feet, and those can get infected with Staph aureus, including MRSA. And then they can get what we call a cellulitis or even a bone infection with this organism. When they come in with an infection, we culture. We do blood cultures, we do cultures of the wound, and it will grow it. And once it grows the Staph aureus, we test it to see what antibiotics will work. And once we know, then we can use the right antibiotics for it. Just trying to take care of your health, proper nutrition, cleaning your cuts and wounds. If you're diabetic or you have any kind of nerve problems, then seeing what we call a podiatrist, a foot doctor, and being aware of your feet if you have cuts, because they often don't feel cuts when they have them, so they can get infected. Just for people in general, There's actually something that you can use, especially you may not know if you have it, or sometimes people will have little boils on their skin, and that's probably MRSA. And we see this a lot in young people. It's not serious usually, but what you can do is use Dial or Safeguard soap, and particularly the Dial liquid soap. And what you have to look for on the back is where it says active ingredient, and it should say triclosan, Triclosan. And that should be somewhere between 11 and 15%, or 0.11 and 0.15%, I'm sorry, as the active ingredient. And that actually kills the bacteria. And I tell my patients, I tell everyone who gets these little skin boils, and it's probably MRSA, just like little pimples caused by MRSA, I tell them to use that. If you can clean your sheets and clothing with that sometimes, do that as well. And if you use that every day, then that should help decrease the colonization of the MRSA on your skin, and also decrease the chances of you giving someone else colonization with that. Depending on, there are some immigrant groups, I shouldn't say populations, but groups who may live in close quarters. And the one thing about infectious diseases is it's an equal opportunity entity. People can, there are certain situations where wealthier people may not get they're less likely to get some of these infections because they're less likely to have the exposure, being in large crowds, having a little bit more health if they have more money and more nutrition. But across the board, something like smallpox, something, influenza, it can get anyone. And with MRSA, with respect to the immigrant population, people who are living in close quarters together, and that includes students living in dorms, you're just more likely to, if you're in a more crowded situation, you're more likely to have more of that contact with someone who might be having some nasal carriage or having it on their skin. We have special antibiotics, and we treat it based on the disease, the illness, the location of the infection, and what it's sensitive to. So something like, I've had patients come in with the skin boils, just come into clinic, and we culture it and it's MRSA, and we look and see what it's sensitive to. We might treat them for 10 days to 2 weeks, depending on the degree of how bad the skin infection is, with clindamycin or Bactrim, depending on what it's susceptible to. And we'll also give them something for nasal carriage. They put it in their nose. It's a little cream, and they put it in while they're getting the treatment, the antibiotics, to try to reduce the nasal carriage. And then I tell them to use the Dial soap, and often that will help. If they have a bone infection, they need intravenous antibiotics for a good 6 weeks or more, depending on their immune state and all that. And again, we look at what it's susceptible to. Often we'll use something called vancomycin, which it is susceptible to for the most part. And so we would use something like that. For blood infections, we would use vancomycin for a couple weeks. Unless it's in their heart, then they have to have longer treatment. So again, it depends on how serious the infection is, how invasive, and that will determine, and the resistance pattern, that will determine what drug we use and for how long. It could be any of a number of things if they wait to go seek medical attention. With the flesh-eating form of it, which we call necrotizing fasciitis, that overwhelms people so quickly that by the time they get to the hospital and start treatment, it may be too late, because this bacteria can also produce toxins. So it's not just the infection that's causing the illness, but the toxins causing the tissue breakdown and illness as well. And so the antibiotics work against the bacteria, but it doesn't work against the toxin that's already formed. So for something like that, like I think there was a young woman who had nipple piercing and developed this infection, and actually her entire breast had to be removed because it was so bad. They had to, what we call debride, which is just like scrape all of that dead tissue off. I'm sorry if I'm too graphic, but and that was the only way to save her life. Some people do die, and that's, again, they may not get medical attention soon enough. We may not have a diagnosis soon enough. It might, the antibiotics, the appropriate antibiotics may not have been started soon enough because we didn't know what the infection was, or if the infection is in their heart, sometimes that, in their heart valves, then people can die from that. They can have it go to their brain. And with that, we can give antibiotics, but there's no guarantee that we'll be able to treat them and save them. Partly depends on how the culture is done, but some cultures can grow within a day. It depends on how much bacteria is there. I know that the media makes a big thing out of this new flesh-eating bacteria. It's not new. It's been around for a long time. It's just, you know, something to talk about again. But I think the big thing is, if you have a wound that looks like it's not getting better after a day or two, then seek medical attention immediately. Don't assume that it is or isn't some infection and that you can treat it with any antibiotic, because that could lead to drug-resistant infection. Seek medical attention and take whatever is prescribed for the complete amount of time. Don't stop because you feel better. If the prescription is for 10 days, take it for 10 days. Don't stop at 7 days, okay? And then the other thing is, I had mentioned using the dial. I think that's very important. I think that can cut down on a lot of the carriage that people have. I've seen it that it is somewhat effective, so I would recommend that as well.